this is the axis and the planes of the embryo. When we people are standing in an erect posture, we have the planes which are different or axis different from the baby which is present within the mother's womb. So the baby takes its position within the uterus. So the axis will be changed. What are the axes? This is an anterior-posterior axis. So this axis is called the anterior-posterior axis of the baby, and the cranial and caudal axis, that is from the head end to the foot end, this is called the cranial caudal axis. So this is called the axis of the baby. Anterior-posterior axis and the cranial caudal axis, because the baby is within the womb taking the shape like a C-shaped pattern. Now there are different planes which will come in respect to the baby. This is the midline where the baby is divided into two halves. That is the sectioning through the midpoint, middle line, that's called the median plane. Parallel to the median plane, this is called the sagittal plane. Okay. Then this is the plane which is perpendicular to the sagittal plane. This is called the coronal plane. So one is the median plane, one is the sagittal plane, one is the coronal plane. And when it is anterior-posteriorly, this plane which is occurring, this is perpendicular to the coronal plane. This is called the transverse plane. So in case of the embryo, we will talk about the two axes, anterior-posterior axis, cranial caudal axis, and respect to the plane. One is the median plane, sagittal plane, coronal plane, and the transverse plane. In different aspects of the embryology classes, we will see the structures which are present in different planes. That will make the subject more interesting and explainable to you.